Their job often comes with struggles, but this is a new one. Never before have they worn these suits, but those who look after others must now take extra care of themselves.
I've ripped it already.
What's it like trying to put all this kit on?
It's very challenging. It's not the easiest thing to do. The suits are very uncomfortable and stiff.
There is very little comfort for these carers who deal directly with COVID-19. That means masks too, worn for up to 12 hours. Can you actually communicate in those things?
You can, but you've got to talk quite loudly. I don't know if you can hear me.
Just about. Just about hear you. Those hard of hearing are left only with this sight. These carers are visiting Margaret Lowe. She has dementia and, as of last week, COVID-19 as well.
Because medically the hospital could no longer do anything for her, they sent her home, quite rightly, because they need the bed. So we've now got carers coming in 4 times a day.
With hospitals trying to clear space, dealing with the discharged requires painstaking precautions, and we kept a safe distance too. Are you worried for your own health having to wear this and go into some of these homes?
No, I feel more protected in these suits than if I was an ordinary carer, just going around in an apron and double gloving.
Those on the regular rounds are also breaking routine. They now deliver shopping and medicines, but there are some things they can no longer do.
There you go, Doug.
Thank you very much.
All right, making sure you're okay. Yeah. My natural instinct would be to just perhaps hold their hand or even pat their back. And it's that contact that means a lot that we can't do any longer because of the risks.
In fact, this firm is now training families like Alan's. Sickness means staff are short and relatives pose less risk.
It's not the greatest idea, but I think it's better than people coming in and we don't know who's coming through the door or where they've been previously. I feel like we live in a giant care home at the moment, an open-air one, if you like.
Back at base, the office is emptying. Around 75 carers are self-isolating. This is the help the managers had.
So these are the masks, and we had 300 of these, single-use only.
The government sent 300. They do 24,000 visits a week, and it is taking a toll.
And we don't feel like we can do enough. The responsibility for these very vulnerable people and the team. You know, we love what we do, we love our clients and we love our team, but it's such a fast-moving situation that we don't feel in control.
You're being asked too much?
It's enormous pressure, and there is community spirit, but people really need to get behind us, not just the NHS. They need to get behind the care providers out there as well.
The government keeps promising more equipment, but as they face demand like never before, who do our carers have to call on? Paul Brand, ITV News, Hertfordshire.